Okay, today we have an athlete coming in with a forearm flexor strain. Her chief complaint is point tenderness on the medial aspect of her forearm. She has painful range of motion, and then manual muscle testing showed a weakness in wrist flexion and pronation. This is an acute injury, and we decided we're going to use a TENS unit to allow us to get through a effective rehab session. So using the TENS unit, first we're going to explain to the patient what she's going to feel. And she's going to feel a very slight tingling, a slight pins and needles feeling. We don't want any like stinging or burning or any muscle or motor contraction. If we see a motor contraction, then we're going to turn it down until we don't see one. Until we don't see one. So now we're going to go into setting the parameters on our TENS unit. For high TENS, it's also called sensory TENS. You want a low pulse width, anywhere between 60 to about 120. And then for the pulse rate, you want a high pulse rate. So we're going to go upwards of 100 pulses per second or megahertz. Okay, now that we've explained the parameters of the TENS unit and how we're going to set up the TENS unit for high acute sensory TENS, we're going to prepare the patient for her treatment session. So first we want to clean the skin. So we get an alcohol swab and clean the entire forearm right there. We make sure and ask the patient to pinpoint where she's most painful at, and she said she's most painful about right in this area, so kind of in the muscle bellies of the flexor pronator group. And from there we're going to apply our electrodes. And we want to kind of bracket that painful area. So if the painful area is right here, we bracket it with our electrodes. We're using 2 electrodes, which is a bipolar technique. And since we've already instructed the patient what she's going to feel, she's going to let us know when she starts to feel that slight tingling sensation. And so now we're going to turn our TENS unit on, go slowly, and wait for her to tell us to stop.
Stop.
And now that we're stopped right there, we're going to instruct her that she wants to feel this sensation throughout the whole time. Her body might adapt to it after about 10 minutes or so. So we can show her how to increase it on the TENS unit herself, or we can just come back and check on her and turn it up as we need to. So the proper application time or duration of this treatment is going to be about 20 to 30 minutes. You can leave it on longer, but for convenience reasons, we'll do it for about 20 to 30 minutes. And then after the 20 to 30 minutes are up, we're going to go into our rehab, which we have about a 30-minute to an hour window of using the effects from the TENS unit to allow us to complete our rehab session. And so for the rehab session, we're going to go through range of motion exercises, do some active range of motion, and then some manual therapy, some massage or something like that. And the high acute TENS is going to use the gate control theory to modulate pain. Okay, now that we've done high TENS or acute TENS, we're going to move on to our low TENS portion of the video. Now low TENS, it's also called motor TENS, is going to be used to treat chronic pain, whereas that high TENS was used for acute pain. So this is going to be something the patient's been dealing with for months rather than about a week or so. So to begin, we're going to show the parameters on our TENS unit. So for low TENS, we want a high pulse width. So we're going to move our pulse width to about 240 to 260. We're going to put it at 240 for this treatment. And for pulse rate, we want a low pulse rate, anywhere between 1 and 10, and we're going to put it at 2. And so everything before this is the exact same as earlier in the video, all the reevaluation, and then explaining to the patient what she's going to feel. For low TENS, she's going to feel more intense tingling, so a little bit of almost like a burning or stinging sensation, and we want to look for a motor contraction of her wrist. So a little flexion of her wrist is kind of our go-to on the intensity and when we need to stop. And then so now we're going to go into showing how to use this application. And so most of her pain is right in this area, so we're going to bracket that pain. You could also put it on a motor point, and to find the motor point, you kind of just press on the muscle bellies, and where she's hypersensitive compared to other areas, that's kind of where that motor nerve is innervating that area. And so now we've already instructed the patient on what she's going to feel and what we want to look for. We want to make sure she's relaxed. We're going to turn it on slowly. She's going to tell us when she starts to feel something.
I feel it.
So she feels it now, and you kind of see that contraction. So we're going to keep it right there. And then for low tens, you keep it on for about 40 minutes, and then move on to your rehab exercises or manual therapies to treat the patient. And then this form of TENS is using the endogenous opiate system of the body. So this is really targeting the third order neurons, whereas the high TENS or acute TENS is really targeting the first order neurons.